Hey, so guys, welcome to the Moms at the Table social distancing episode. We're here with Dr. Andrew Pennington, who's a GP at the Sanctuary Lifestyle Clinic. And we're actually here to talk about something a little bit more serious. He's here actually to answer all the COVID-19 questions that we have. And a lot of the questions actually came from our Moms at the Table Facebook group. So be a part of the group and you can ask more questions there as well as get some support from other moms as well. If you have any other COVID-19 related concerns, check out our website, momsattetable.com, where you will be able to find more information related to COVID-19 as well. But here with us, Dr. Andrew, thank you so much for coming.
Pleasure.
I think maybe the first question I need to ask you about COVID-19 is what all moms are worried about. How worried should they be for their kids?
Not very is the
Why not?
answer. Why not? As you know, this is fairly new with the data coming out because it's a novel or new virus and we don't have heaps of awareness about it yet. But what we do know is of the many thousands of cases that have been diagnosed, children do very, very well. In fact, so well that there has been no reported deaths between the ages of 0 and 9 anywhere, to our knowledge. Okay. So mums and dads who've got children in that age group should have almost no concerns that their child will die. I guess it is certainly possible for a child to get quite unwell, although this seems to happen very rarely. For those it does happen to, it's often children and adults, when we talk about adults as well, but those who've got some form of chronic illness already. So those are the people who may be more at risk of harm from COVID-19. But in general, the vast majority of children, and I mean the vast majority, like well over 90% of children, will develop, if they get the virus, will develop mild symptoms such as a cold or flu, and in fact probably handle it much better than you or I would as an adult. And they may not even really know that it's any different from any other cold or flu.
Oh, that's a relief. What about for kids? They're kids now, but they were born prematurely.
Look, again, it depends a little bit on what any sort of problems that may have come from that prematurity. For example, if they have a chronic lung condition that came because they were premature, that could, in theory, be a problem. I don't think we've got a lot of data to know whether premature children who are now, let's say, 2 or 3, are at any greater risk of COVID than any other children. And my general knowledge on this matter is that children who are 2 or 3 who might have been, let's say, 34 weeks premature are usually doing very well anyway and are not likely to have any more harm than anyone else.
What about children or adults who have asthma?
Yeah, it's a really good question. I was just looking at this beforehand just to get my facts right, but currently the National Council of Asthma in Australia suggests that it's too early to know what the effects of COVID-19 are on asthmatics. We don't have enough data to know if children or adults who have asthma are any worse off than anyone else. It would be reasonable to deduce, because we often see that viruses trigger asthma in many patients. So it would be reasonable to deduce that those people who have asthma might be at more increased risk of having asthmatic consequences if they got COVID-19. And so, if I saw someone who had a diagnosed case of COVID-19 and they're asthmatic and they've got asthma symptoms, I'm going to treat them as if I would of any other asthma patient. So they should certainly be vigilant. And for those of your mums or children who already have an existing asthma action plan, hopefully they do. If you don't have that, you should see your GP and get one, because it gives you guidance as to what to do in those scenarios if your child gets sick. And basically it's ramping up the asthma treatment.
Yeah, that's good to hear, because, my 3-year-old Elliot, he's got asthma as well, so we're expecting something, but yeah, we're going to have to...
I should just add this little point on. If you have a very severe asthma, for example, you are quite dependent on either one of the newer biological drugs, or you're on steroids regularly, or you're constantly on preventative puffers, these people I would be more concerned about than someone who had occasional asthma triggered by a virus every now and then. But that's probably the best we can tell at the moment.
You did mention something quite interesting about the use of the nebulizer, though.
You're right, yeah. So we learnt this from the first SARS virus, which is a coronavirus very similar to COVID-19, that unfortunately the use of nebulizer agents in the hospitals actually spread the SARS virus to health professionals. So since that time in the early 2000s, it's actually been recommended not to use nebulizers except in extreme circumstances, and that's pretty much taught in most medical settings now. So certainly in my clinic, although I have a nebulizer, I've never used it. I always recommend a puffer and a spacer, and you can give an equivalent dose of what you would in a nebulizer using an equivalent amount of puffs and spacer, and usually you can get the same effect.
Okay.
So I think that's an important strategy to prevent spread of it for the health practitioners,
Yeah.
and possibly, the parent, if they're around the child when the nebulizer's on,
Yeah.
they don't really need the particles of virus spread into their nostrils either.
So basically, your recommendation would be if I went to a GP, because this is what usually happens. If I go to a GP and say that, Elliot has an asthma attack, she would put him straight on a nebulizer, probably say, maybe let's just try the puffer first.
I think that would be a much wiser choice.
Okay. I want to talk a little bit more about COVID-19 and the symptoms. Can you have it without, can you have COVID-19 without showing any fever or without any symptoms?
That is possible, yes. I tried to sort of find this little graph in the literature where I saw a graph of proportion of symptoms of people who had COVID-19. I think it was something like 80 to 90% of people will have a fever with COVID-19. Cough was about 60%, and shortness of breath was about 40%. So, and muscle aches and pains and other things were also there as well. Interestingly, runny noses didn't seem to be a high proportion of people with COVID, so it's not really, if you get a runny nose, you're probably a lot more likely to have a common cold or flu rather than COVID. But yeah, you certainly can have COVID-19 without having a classical fever. And in fact, I think the people who would be more likely to have this would be children. And there are some case reports of asymptomatic children, that is no symptoms, testing positive to the virus, although this is still not that well determined as to how many people can have no symptoms and still test positive. Although we did have you may remember the famous case of Dr. Higgins in Victoria, who really had a mild cold and was at the end of it, didn't meet any testing criteria from our government, yet still went and had a test and was positive, and then got berated by the health minister for treating patients even though he didn't meet the criteria for testing, which was interesting. So it's obviously quite possible for people to have mild symptoms with COVID-19. And I should also add this, the data that we know at the moment, 4 out of 5 people who get it have mild symptoms, more like a cold or flu, and don't have severe symptoms. But I don't want to underestimate how important it can be, or how devastating it can be, I should say, because we've all heard the reports out of Italy recently as well, where it's overtaken China now in the death rates, and this is devastating. Because I think they've had over 5,000 people die from this virus. So it's certainly deadly, but this tends to be in the elderly age groups and chronic disease age groups, or chronic disease people, rather than children.
So even though you're asymptomatic or you might be mild, it's why this whole social distancing thing.
Oh, absolutely. So some people might be wondering, well, okay, so we'll let my kid get it, it doesn't matter. And in some sense, that's true. Like if my child gets COVID-19, I'm actually not going to be terribly concerned about it, except that they can pass it on to me or pass it on to someone elderly. That's what I'm much more concerned about, is that they could be a carrier, or I could be a carrier that passes it on to a vulnerable person. And that's why social distancing and social isolation practices, where necessary, are vitally important. Because if we're blasé about it and I go, oh, well, who cares, I'm robust, I'll be fine, and then I get it, and maybe I will be fine, most likely I would. But if I happen to, see someone else and treat them or touch them or whatever and cough around them, and they were elderly and they had a heart disease, and then they got very sick from it in ICU or died, that's the real risk. And that's something which, of course, in good conscience, I would never want to do.
So they say that the virus, the incubation time is between 2 to 14 days.
That's right.
But when do you start being contagious?
Again, the data on this is not entirely clear. What we probably can say is that when you have symptoms, you're most likely to be contagious. That is cough, fever, breathlessness. So if you have those symptoms, particularly the worse they are, so if you're coughing a lot, you're likely to be quite contagious. There may be reports, or it may be true, that you might be contagious for a day or two before getting symptoms of these things. This may well be the case, but I don't think we've got enough data yet to be sure about that. So it's a bit hard to say just yet.
It's hard to say about everything related to it, isn't it?
Definitely.
I think we're just all learning about it at the same time.
For sure. Yeah, for sure.
So if I'm coughing, if I start coughing now, do I then decide that I should go self-quarantine myself?
Well, I think that's a very wise idea. I mean, just in general, even if you had a flu, you don't really want to give the flu to anyone else either. But as a doctor, if I'm thinking about what I should do for someone like you who might start developing a fever or cough, really what I'm doing is trying to work out your risk of COVID-19. Now, I think, I must say, this information will change with time. Almost certainly what I'm saying now will not necessarily be true next week. And there's conflicting ideas around. Like, for example, our government tells us at the moment that the people I should test is those who've come back from overseas in the last 14 days who develop symptoms, not just anyone who comes back. Anyone who's been near a confirmed case of COVID in the last 14 days should be tested, okay? Or any healthcare workers who treat patients and get symptoms, because they're obviously at high risk of passing it around. And anyone who has a pneumonia without a direct cause in hospital should be tested for this. So there's a few criteria that we would use to definitively test. But look, we just talked about Dr. Higgins, who did not meet that criteria and tested positive. So it's the data as to where what we do here is a bit conflicted. And the World Health Organization, I remember seeing the Director General there speaking only a few days ago, and his advice to countries was test, test, test. So he thinks we should do more tests rather than less tests. So this is where there's some confusing advice around. But I guess I have to follow best practice guidelines in Australia right now, this minute, until next week maybe it changes, where we would test those people that I just mentioned earlier. Yes, of course, there's been people who've wrangled a test off their doctor who probably didn't meet the criteria, and most of those will test negative, I'm sure, but some of them will probably test positive, and that's, I guess, a matter that we'll find out more about as we go.
So if I start showing some form of symptom, your advice would be to self-isolate. And you also mentioned that there was a way that you could potentially just call your doctor?
Absolutely. So thankfully, one of the good things the government has done is that they've introduced some Medicare item numbers for doctors to consult people via video conference or phone if not available via video conferencing. And this allows, at the moment, it's just for people who may be at risk, and those people are confirmed cases, people who've been asked to quarantine by government regulations, people who have come back from overseas in the last 14 days and developed symptoms, pregnant women, mothers with children under the ages of 12 months, and people with chronic illnesses. So they're all eligible for a Medicare-funded phone consultation. That's great for me because I don't particularly want someone with coronavirus coming into my clinic. I want to be able to triage them from afar and, if needed, advise them to do a test. So that's great. However, it still leaves out a number of people who don't meet that criteria, and at the moment I either have to charge them privately or do it for free. But that may change. I just heard rumours this afternoon in the news that it's possible that the government may be extending teleconferencing without limit to all people for whatever reason, and I think that would be a very good thing because there's a lot of people who are needing to do social distancing to avoid contact if possible. Our governments are telling us, please don't do travel if you don't need to. Please, if you're elderly, try and keep at home. if possible, our Premier just today has suggested that children should not go to school if they don't have to. So, we're trying to do a lot of home-based stuff now, and if you don't have to come to the doctor and you could have it via a teleconference, that would be a good thing.
Yeah, because, I think the greatest fear is right now you will only get tested if you are in contact with someone who's been tested positive. But what if you were in contact with someone who's tested positive but you didn't know?
Well, exactly right. But that's what the public health departments are for. So they do contact tracing, and so I'm sure they're overwhelmed at the moment. There must be a horrendous job at present. But every time a case is confirmed positive via a pathology test in the lab, that's immediately notified to the public health department. And what they will do then is come and talk to that person who's diagnosed and ask them where they've been in the last 14 days. And they're going to try and track down, who could that person have been in contact with. So it's a mammoth task, right? But that's that's what they're paid to do, right? Is to track down these kind of contacts, and that's how we understand a little bit more about where it's going in our community. But it's going to get, it's already at the point where there is an exponential spread of this around. It's going to overwhelm the capacity of our public health units to deal with the contacts. It'll just get overwhelming.
So if you stay home, then you'll be probably safe then.
Well, look, there's a great case to be mounted for that, and I must admit it's really only been in the last couple of weeks that I've become, shall we say, more aware of the seriousness of this and the need to do social isolation and social distancing practices. And it makes complete logical sense, though, if you just really think about it for a moment. These droplets come out. It's when people are in close contact, you're much more likely clearly to be contacting someone, touching a surface nearby them. And, if you don't do that, if you stay at home, you're going to be far more likely not to come in contact with it. So it just makes complete logical sense to do that. But of course, I think what governments are trying to do is balance the fact that the economy is going to go, when we close down everything, already is, and the disruption to our life as we know it is significant. So we're balancing that up with obviously the risks of people dying and people becoming seriously ill and our hospitals and intensive care units being overwhelmed. And unfortunately, that's what happened in Italy, which is a really very terrible case study to learn from. But they were their ICU beds were full. They were turning people away. They're saying, we can't treat you. And people were dying. And they, I think it was 700 people last night died from the virus. So it's very severe in these countries where they didn't put social distancing things in place soon enough.
So you did mention earlier on that if you have been diagnosed with COVID-19 and all your kids, chances are it's not going to be that severe. So you're probably trying to recover at home.
Absolutely.
What do you do at home?
Yeah, good question. Do you mean if all of you have it or if just one of you has it?
Either or.
Okay, well, I think if all of you have COVID-19, hopefully there's not too many people in this category, then you may as well share everything together and just keep away from everyone else. But let's just say that you had one family member who has it and no one else does, then this is where you're going to have to practice internal social isolation. That is to say, the person who has it probably should have their own bedroom. They should have their own bathroom. They should have their own rubbish can. They should have their own towels and things like that, their own sanitary products. And you should keep away from them, unfortunately. So they shouldn't eat with you. They shouldn't be watching television with you. They should do it all in their own setting. And you're going to need to be careful about the contact you have with that person. And that may be, so for example, if that person's put stuff in a rubbish bag, tissues or whatever, probably the person who's infected should tie it up, and then let's say I'm caring for them, I should put on some gloves, get the person who tied it up to go away, and then I come and pick up that bag with gloves on and take it away, and then dispose of the gloves and wash my hands afterwards. And it's those kind of precautions needed that you're probably going to need to do in order to prevent that spread to your own family members. And yes, you are going to need to isolate too. Both the Australian and New Zealand government regulations are as if you have a family member or you're in contact with, you're living with someone, you have to isolate for 14 days as well.
With a 3-year-old, if he's got it, I'm pretty sure that's...
Well, it's almost impossible, isn't it, if you
true.
don't know. I mean, I think, to be fair, you know, young ones who are highly dependent, you can't really isolate them, can you? I mean, imagine if you're breastfeeding your child, you can't really say, sorry, mate, off you go. You know, that's ridiculous. So you're going to have to take your chances. But even then, you might get away with it if you practice very good hygiene. Maybe you need to wear a mask when you're interacting with your child. Maybe you need to wash, well, not maybe, you should be washing your hands after each interaction that you touch them, or that you've handled things that they've handled, that kind of stuff. So it's a lot of hand washing or a lot of alcohol gel, and some very strict practices. But, you know, you might get away with not getting it if you're careful.
What about the role of paracetamol and ibuprofen?
In someone who's got symptoms
Yes.
like fever, etc. So there was some initial fear that ibuprofen may be enhancing the transmission of coronavirus. That may be the case, but I've sort of looked at some more official sort of guidance on that matter from the World Health Organization and others, and at this stage they can't confirm that that's the case. So it may still be a good idea to avoid the use of ibuprofen, that's Nurofen or Advil, if you don't need to. Paracetamol seems to be fine if you need to use it. I mean, if you don't need to use a drug, don't use it. I mean, I think there's ways you can manage particularly fever without the need to resort to a medication, and those are things like, you know, cool flannels, taking clothes off you don't need, you know, cooler baths, etc. But if you really are in a lot of discomfort or your child's really just very miserable, then I would be reaching for paracetamol before I'd be reaching for ibuprofen or Nurofen. And just the usual measures that you would probably take for a cold. You know, you can put some salt water in their nose, you can use some eucalyptus rub, you can give them some vitamin C and zinc, things like that, which are likely to be generally good to fight viruses, and let them sleep. Good nutrition, all of those other things are helpful.
Speaking of which, there's been, you know, memes and emails and posts going around about what you can do to potentially fight the coronavirus. What is your tip on how to boost your immunity for coronavirus? And does it include, you know, drinking hot water or colloidal silver?
Okay, sure. Look, it won't come as a surprise to your viewers to hear me say that a good lifestyle is the basis for good immunity. And what I mean by that, of course, is I'm going to start with sleep. I think that, I know that obviously parents of young kids may be lacking in it, but wherever possible, do not skimp on your sleep. If you can get, as an adult, 7 to 9 hours sleep, that's really what your body needs, and your immune system is reset every night when you sleep. So that's a really effective strategy. Don't tell me you can get by on 5 or 6 hours. Your immune system will not thank you. Regular exercise is very helpful too, but not over-exercise. So we know that marathon runners actually have worse immune function than those who do moderate activity. I would suggest those who want to, do very long workouts at the gym or very hefty exercises or marathon running, this is not the time for that. I would be more inclined to be looking at moderate activity for 30 to 60 minutes of, relatively light or moderate activity. And of course, a good diet, a healthy, nutritious diet that includes a lot of whole plant foods, that provides fibre to your gut, which will do a few things. It keeps the gut healthy, and that helps your immune system, because we know that the immune system communicates with the gut regularly. But of course, it also provides a lot of nutrients, and those nutrients may have antiviral properties in and of themselves. And we can talk about some of these now. So some people might ask, can you use some supplements to boost immunity? Yes, you can. Can we specifically say in COVID-19 that this will definitely prevent it, or that you'll be able to treat it? Not really. We can't specifically say that, although we can postulate from a number of different studies that have been around, both some in rats, some in vitro, some in humans, where they have shown that there are many different nutrients that have antiviral properties. Again, specifically for COVID-19, not a lot of data yet, so you can't totally say that, but you might be able to extrapolate that it's generally good for your immune system. So the things that I start with are things like vitamin C. So there's a little bit of data coming out of China at the moment that taking regular vitamin C and even intravenous vitamin C can help protect the lungs from having a severe infection, and that's the acute respiratory distress syndrome, which often can lead to death and the ventilation that is required in ICU. So there's a little bit of evidence. It's not very strong just yet, but certainly oral vitamin C I would use liberally. I'd be happy for people to have 500 milligrams every couple of hours if you got unwell, and you may well help it yourself a little bit. Zinc is a helpful nutrient for many viral infections. I generally recommend about 30 milligrams a day. Some people are talking about zinc lozenges having an antiviral effect. I believe that's true, but I haven't sort of seen easily how to find them, so I just normally recommend just zinc as a tablet. Vitamin A has been used for many years to fight viral infections. Before we had any vaccines for measles, people used to use vitamin A and other vitamins to try and treat measles, and it tended to help. And the World Health Organization still recommends, particularly in third world countries where there's a lot of viral gastroenteritis and bacterial gastroenteritis, that vitamin A is used in those scenarios. And there's a number of studies that show it reduces mortality. And vitamin D is another helpful nutrient. So most of us should know that this is the sunlight vitamin, or sunlight hormone, if you like. And again, there's some evidence that improving your vitamin D levels will help your immune system. And we also know that people with low vitamin D levels are worse off when it comes to fighting infections. They're more prone. So how much? In an adult, I'd have no problem recommending 3,000 to 5,000 international units every day of vitamin D, particularly during this time frame. And almost certainly it won't cause you any harm.
But this is not about, going out and panic buying and hoarding everything.
No, absolutely not. Take as much as you need for the next couple of months. But yeah, please don't buy 20 of them and stockpile them. I mean, that just means that no one else can get it. So no, you don't need to do that. Buy as much as you need for the next couple of months. If you need to batten down over the next sort of 2 or 3 months, yeah, sure, buy a supply for that period of time.
And having, how you recommended this much, having more of it, more than what you've recommended, isn't going to be...
Probably not, and again, it's just from a lack of evidence here, and also that we know that if you take really high doses of some vitamins, you'll cause harm. So I must say it is quite hard to cause harm with vitamin D. It is quite hard to cause harm with vitamin C too, and also zinc, I may say. So it is hard to do that, but it's not impossible. And like anything in your body, balance is generally what's required. So yes, you don't have to use excessively high doses.
There's a thing going around about how if you drink water, specifically hot water, that it will flush the virus into your stomach and kill the virus with the stomach acid. What is your take on that?
So firstly, of course, hydration is good for us. Drinking water is good. I don't know of any evidence for this practice. I can't refute it to say that it doesn't do anything. Maybe it doesn't. I did have a quick look on the World Health Organization's website, and they did have a little informational card on that suggested that drinking water is actually not a way to prevent coronavirus. So they didn't specifically say hot water, but I would hazard some level of skepticism that that's actually likely to prevent it taking hold. I think much more effective are the other measures that we've talked about. But I can't totally dismiss it as maybe having a role.
Well, one final question. When I step out of this studio today, do I need to pop a face mask on? Do I need to have a face mask on wherever I go?
It's a good question, Melody. Look, I know that culturally in places such as Asia, it's very common for people to wear face masks when they have a cold or flu, and maybe that's a polite thing in their society. The current recommendations in our culture from the government is that not everybody needs a face mask. They would suggest if you have symptoms of a respiratory illness, the best thing is social distancing and isolation if necessary, and washing your hands frequently, etc. Those things are more effective than a face mask. However, if you had to go to the doctor, or you had to go out to the pharmacist, or you have to do some shopping and you've got symptoms, then yes, I would put a face mask on. If you're a health practitioner, and most health practitioners who might be watching this will already know this, that they are at higher risk and they should wear a face mask if they're seeing patients that may have contacted anything to do with a respiratory virus, and I certainly put one on in any of my patients who might remotely have symptoms. But not everybody needs to, and if you're self-isolating at home, you don't need a face mask, right? You've only got your home environment to infect. Although that might, suppose if you've got other people looking after you, there could be a case made for you putting on a mask at times where you may need to interact with them. So I wouldn't put a hard and fast rule on it, but in general, no, you don't need to wear a face mask everywhere you go. If you feel more comfortable doing it and you can access one, well, okay, fine, that's be my guess, but it's not entirely necessary at this point.
Well, I think that's all the questions we've got. Well, thank you for your time, Andrew.
Pleasure.
And thank you so much for watching. Coronavirus, it's a rapidly changing kind of situation that we're in. So basically, I think the most important thing is just to check out the government websites if you want to keep on top of what is actually happening in your area. Health.gov.nz for New Zealanders, health.gov.au for the Aussies. I will also put the link up on the comments section as well for you to find out. Also, check out mumsattetable.com if you can, because we'll give you a lot more support on how you can actually get your family through this pandemic crisis. Thank you for tuning in.